Hello, Namaste. I welcome you all to the 102nd session of Gurubodha. On behalf of us, all of us students, I cordially welcome Dr. Gururaja sir to this session. Good evening and Namaste, sir. I also cordially welcome Dr. Raghuram sir to this session. Good evening and Namaste, sir. This session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. Dr. Gururaja sir runs Dhavala Pentacare Ayurveda Treatment Center in Shumoga, and he can be contacted for case discussion or treatment at easyayurveda.com/Guru Raja. Dr. Raghuram sir is Chief Content Officer at easyayurveda.com. He can be contacted at easyayurveda.com/Raghuram. So the first question is to Raghuram sir, that it is increasingly becoming a fad these days that cannot be told as fad, a commonly observed phenomena that has become increasingly health conscious. We see a lot of celebrities and general public taking a lot of supplements, and so demand for even Ayurvedic therapies has also gone up. So in that, generally the general public might have heard massage therapies, massage and steam, or massage therapy alone, or they also may have heard Panchakarma therapy. And we get a lot of queries in through our website saying that I want to undergo Panchakarma therapy and all. So before we actually get into this question, Raghuram sir, can you please break it down for us, the Panchakarma therapy for healthy person versus for a patient? How would you look at it, and what are the considerations to be made?
Absolutely. Important question, Heber sir. See, first of all, we need to understand what is Panchakarma. Panchakarma is a set of 5 therapies or interventions. So we can call them as special tools which Ayurveda has, which basically includes the Shodhana Prakriyas, so that is methodologies to deep cleanse the system or purify the system of its impurities, morbidities, toxicities, whatever you can call it as. Panchakarma therapy, also some people have named it as detoxification therapy, named according to the convenience. So is Panchakarma therapy, but the word Panchakarma is definitely popular. Pancha is 5, karma is the procedures. Karma is actually an activity. So here a therapeutic activity is called as karma. So 5 types of therapies are included in Panchakarma. Now, as you said, it may be a fad or misnotion or whatever it is there. A common man knows Panchakarma in a different way. So they don't know systematically as we Ayurveda people know. And some people are like too much into Ayurveda. So non-Ayurveda people also go deep into Ayurveda, try to explore before telling something, asking something. So here what happens is, even a just herbal oil massage is said to be Panchakarma. So I have heard many people tell that I am going to a Panchakarma clinic, I am taking Panchakarma treatment. Only when somebody asks what exactly you are undergoing, they may tell that they are giving a body massage, as Heber sir rightly pointed out right at the beginning, and some steaming process. They call that as Panchakarma. Okay, some other person goes and takes Nasya, so the nasal therapy, or the air hints or nasal drops, we call it as. And even that person will tell that I am undergoing Panchakarma therapy. So this Panchakarma therapy, this word has been grossly used rather than being used choosily or selectively to define all the 5 treatments. As Dr. Heber has already typed down those things, we have so many therapies: Vamana, Virochana, Astapana, Anuvasana, Nasya, or Shirovirachana. So all these therapies fall into the Panchakarma therapies. So a common man, as Dr. Heber sir said, it is getting popular. This word itself is very popular and popularly misused as well, because people don't have an basic idea of what exactly is Panchakarma. So even Pancha is a word which is not only used in Sanskrit, but it is also used in local languages like Kannada, Telugu, everywhere, Hindi. Panch comes from Pancha only. So if people try to deeply explore even before telling something, so they can know that these are the 5 set of therapies, and why a doctor is not conducting all therapies on me. So it is not the doctor's fault. Doctor has never said, I'll do Panchakarma to you. People have read the Panchakarma center, the board, or they think that each one is a Panchakarma. Like Abhyanga is a Panchakarma, Svedana is a Panchakarma, Vamana is a Panchakarma. So like this. Even the Purva Karmas, like Purva Karmas is the pre-procedures, like the Abhyanga and Svedana are also taken into consideration by a common man. So while describing, so these are needed as Purva Karmas, but they are not actually included in their Purva Karmas are not actually included in Pradhana Karma. So going to Panchakarma, so we have pre-procedures like Snehana, Svedana, Deepana, Pachana. So many things are done as a part of the preparation of the patient. That is not what we are discussing today. And then we come to the procedure, just like we have in the surgery, pre-procedures, surgical procedure, and post-op procedures. Here also in Panchakarma, we have a pre-procedure, and then we have a actual procedure to be done, that like Vamana, Virechana, Basti, etc. And then we have the post-procedures like Samsarjana, etc. So we have certain things which we need to do after the Panchakarma therapies. So this is the brief introduction about Panchakarma, the word, how it is misunderstood, misinterpreted by a common man, not because of his or her fault. So because of either lack of understanding or lack of time of understanding, or not being able to explore through that, or the doctor not being able to interact with the doctor and try to know about those things. So when it means health, so people are not at all worried about what exactly the word means. So that is also there. So coming to the next question, the important question, Panchakarma for healthy people, Panchakarma for the diseased people. So we have two main goals of Ayurveda, Swasthasya Swastharakshanam and Aturasya Vikara Prashamanam or Roga Prashamanam. So there are twofold aims or goals of Ayurveda is to balance the health in an already healthy individual, and goal number 2 is eradicate or remove the disease from an ailing person. So we have two types of person, a healthy person and a diseased person. Okay. This is a Panchakarma or a Kaya Chikitsa examiner's favorite question in Viva OC. So they may ask a student, does a healthy person need Panchakarma therapies or Ayurveda treatments or medicines? The student will be tempted to tell no. So because healthy person, why? So this goes with the basics what we learn in Ayurveda. If you are not into the basics of Ayurveda, so the student will be tempted to tell no immediately after the question is thrown at him or her. So here it is, we don't call them as treatments. So like apathya, so that is a normal food or a wholesome and good food what we consume, can also act like aushadha. So it can act like a medicine or a medicament. It doesn't mean that a particular person is taking a medicine, but here the food is acting. The lifestyle activity modulations according to the ages, exercising, keeping away from bad habits, getting up early in the morning, okay, and doing the dinacharyas, the diurnal activities, adapting to the seasons, not withholding the natural urges. All these things are also contributing to the health when practiced daily. Achara Rasayana is a very important one. But we don't call them as treatments or therapies, because they're practices which act like treatments, which act like medicines, which act like therapies, natural therapies. A good sleep, good awakening, so if a person can have. So it will contribute to very much to the healthy individual. So here the question is, what is the difference between the Panchakarma for healthy people and Panchakarma for deceased people? So the deceased people, first I will touch. So here is the rogi. Here we need to build up a protocol. So it is a protocol based and diagnosis based. A person can come to the clinic or the hospital with a diagnosed condition of jwara, so dirgha jwara or purana jwara. So the person is having a long-standing fever which is relapsing. So an arthritis which is not being addressed, a backache which is not being addressed, a headache which is not being addressed, in spite of doing many interventions or taking many medicines. So people have knocked the door at various levels, and finally, or somehow they have reached the Ayurveda doors. So here an Ayurveda doctor thinks, or the Ayurveda basics tell. So first job is to examine at what status the doshas are aggravated in the system, and what is the status of the dhatus, the tissues, how much damage has been done, What is the dosha dosha samurjana? What is the amalgamation, vicious amalgamation of dosha and dosha? What type of pathogenesis has occurred there? How much and in what quantum of our doshas aggravated and have interference with each other's activity? Which organs are disturbed? Which tissues are disturbed? Okay, so all these things and many things we need to do that goes through the pariksha, which will be a topic of discussion some other day. So we have many types of pariksha. Pariksha is examination of the patient, a threefold examination, a fivefold examination, a tenfold examination, all those things. Whatever the doctor is comfortable at OP or IP, the physician should conduct a thorough examination of the patient and decide. So here, whatever Panchakarma measure it may be, Vamana, Virechana, Basti, Nasya, whatever it is there, we have eligibility and non-eligibility criteria. Ayurveda has clearly given Arha and Anarha category. They have categorized so many diseases and conditions where a therapy can be given, and so many categories or diseases in which it should not be given. That the doctor should be knowing. So where to give and where not to give, how to give and how not to give, do's and don'ts the physician should be knowing. So this itself is the exclusion and inclusion criteria. Very important for us. This is Ayurveda screening methodology to screen out the patients who fit into taking Panchakarma, who doesn't fit into taking Panchakarma therapies. Individually, I'm mentioning, when I'm telling Panchakarma, each karma of the Panchakarma has these rules and regulations to be followed. And each therapy of Panchakarma has a pre-procedure, main procedure, and post-procedure, follow everything, the dietetic protocol, everything to be taken. Like after Vamana, after emesis therapy, Dhumapana is advised, which is not advised for Virechana or Basti. So here, Dhumapana medicated smoking is to remove the residual kapha. The kapha has been removed after administering Vamana, but here the residual kapha, if at all, is remaining. Now, a physician should know how to analyze the residual kapha, how it is, whether kapha is remaining, totally it has gone out, what are the samyak vanta lakshanas, what are the... So, Ayurveda has elaborated everything, every minute detail. What are the symptoms of a properly administered emesis? What are the symptoms of an improperly administered emesis? Improper is again inadequate emesis, excessive emesis. What are the complications which can come when inadequate or excessive administration of emesis is given? I'm taking one example of an emesis therapy. Too much vomiting due to emesis therapy can be very dangerous thing. So these things need to be monitored. What are the complications? If less emesis is given, then what should be given? If less kapha is eliminated from the system, if less kapha is eliminated, some kapha will remain in the body, that will cause trouble. If more kapha is removed from the body, we know what is the kapha's role to provide stability and strength to the system. So the normal kapha should be left over in the system. If we even try to remove that due to excessive emesis, that is again potential danger. So everywhere there is a balance, how much the treatment should be given. So these things should be charted out by the physician after thorough examination of the patient and build up a protocol of the Panchakarma therapies. Friends, here Panchakarma doesn't mean that every person should take all 5 therapies. No, it is selective. Ayurveda therapies, these Panchakarma therapies are selective, and it depends on which condition, which disease, what is the status of the patient, what is the strength of the patient, and so many things to be considered, and then that particular therapy should be chosen. Okay, in spite of a person being eligible for a Virechana therapy, if at that particular moment of giving Virechana medicine, if something else, some other abnormal signs are seen in the patient, the treatment has to be stopped. So many things need to be taken as a part of precaution. So when coming to Panchakarma, they are also used as Apunarbhava Chikitsa. That means once the Panchakarma is given, and the doshas have been eradicated or expelled from the body, so the time gap of the relapses will reduce, the cure will be better, the body will become free of toxins and morbidities and morbid doshas, and there is a recovery from the disease. So many benefits are there of Panchakarma. Okay, but they need to be done very cautiously and systematically. So that is one for the deceased person. Now a healthy person can take Panchakarma or not. Not everybody can go and claim or ask whether I need Panchakarma. No, the doctor is the decisive person again. The doctor will decide. For example, if Vamana needs to be given for a healthy person, they can undergo during its aggravation season. So like Vasanta Rutu, the spring season is said to be the season of aggravation of kapha. In such a person, if there is, if in spite of being healthy, the person has some imbalances of kapha during the Vasanta Ritu, or not even, so he or she tends to build up to the kapha during that particular season. A healthy Vasanta Ritu Vamana can be given to the healthy persons also. Taken into consider. Again, how much therapy should be given, how much it should not be given, whether it differs from the normal Vamana which we are giving to a deceased person. Yes, absolutely. That demarcation the physician is going to do. Again, the same parameters work here. Thorough examination of the patient. The physician should declare that the patient is healthy and I am conducting this Vamana or this Virechana according to the season, because so this is a season for giving. So there are many people who take Vasanta Vamana, so the NSS therapy during the aggravation period of the kapha. So that is the Vasanta Ritu or the spring season. Just to feel healthy, just to relax, just to feel happy, just to experience the Ayurveda therapies, many people are taking this. And many hospitals are also advocating these therapies. Okay, so is it right or not? We'll not speak about that. But just like for small variations, even the healthy person is not 100% healthy. So there is nothing called as 100% healthy condition. So these people, so swasthasya swastharakshanam, these people fall under the category of the balance. The people want to have balance. Now what I am at 40, say suppose. I want to be better at 45, better at 50. So while traveling that particular path. So now I will try to explore Ayurveda. I want to keep myself healthy. The Vata, Pitta, Kapha status needs to be under balance. Come to the doctor. The patient comes to the doctor. The healthy person comes to the doctor. Doctor examine what is the quantum of Vata, Pitta and Kapha. What Prakriti is mine, what Vikruti is mine. And if I'm a healthy person, should I undergo a Vamana, Virechana, or Basti? Okay, so the doctor will decide and accordingly it will be given. So it will help in delaying certain disease process, or if you have a family susceptibility of problem or any health issues, those people can take Panchakarma well in advance so that they don't get those diseases. If the disease needs to come, it will definitely come. We cannot prevent that. So again, there is another factor which we don't want to discuss at this particular point of time. So that is a fate, so which has been, so we cannot control certain things, but we can postpone certain things, we can prevent certain things as a preventive measure, and also to experience Ayurveda therapy and as a seasonal therapies, these things can be given. Friends, if you go through the Matra Basti reference and also the Pratimarsha Nasya reference, they can be taken regularly. Pratimarsha Nasya is advised to be taken regularly, though Nasya comes under the category of Panchakarma. So here Pratimarsha Nasya can be taken regularly on a daily basis. Again, why to take? That is a question. Okay, but certain liberties have been given to certain therapies. So we need to know the limitations of Panchakarma therapies, which needs to be given to a healthy person, which needs to be given to a deceased person, and decide accordingly. To sum up, all Panchakarmas need not be taken by a selected individual. So that is a choice of a physician and a choice of condition, what the condition demands. And the healthy people can take Panchakarma under certain conditions, they can. And the deceased people should take Panchakarma whenever, as and when there is a demand. Ayurveda gives a golden principle. If you give oral medications, whatever medication, if in spite of the presence of the morbid doshas inside the system, they keep on attacking your tissues and they will keep you diseased, and also your immunity will come down. So what is mandatory is first to cleanse the body. A beautiful example is given. When you try to paint on a canvas, which is very, very dirty, the painting doesn't look good. At the same time, when you wash the canvas and do a painting on that canvas, it looks beautiful. So this is the simile given for Shodhana prakriyas which are used in Panchakarma. So if you cleanse the body and give oral medications, rasayana therapies and all those things, they will be very, very, very impactful. Without Shodhana, if only the medicines are given or the rasayana therapies are conducted, they may not give the desired result what is expected of them. Having said that, finally I would like to tell, many conditions and many people don't fit into the Panchakarma at all. And in the modern day, they don't have time to take the therapy. So they will ask for plan B. Doctor, I cannot undergo Panchakarma therapy. What is the plan B? Can we treat these conditions with the medicines itself? Again, the Roga Bala and the Rogi Bala, the strength of the patient and the strength of the disease is very, very important. We have seen our Gururaja sir treat so many cases and he's presenting so many cases in our group. wherein with just oral medications and external therapies, sir, is curing so many skin conditions and other complicated conditions. Okay. Even a Nitya Virechana administered with a simple medicine. We have seen Guru sir presenting so many Udara cases being cured. Okay, so this again depends how a doctor looks at a particular condition. What is the strength of the patient, strength of the disease? Depending on all these things, we will decide what therapy needs to be given. Whether the person, when the person totally opts himself or herself out of the Panchakarma, I cannot take this boss. Then we need to come to the best possible interventions where Panchakarma therapies are. So this is the third category of the person where the person fits, but the person cannot. In such conditions also, we can go ahead with alternative plan B. A physician should have the plan B. So here I end up my description of the question asked by Hebar sir. Hebar sir, over to you.
Thank you, sir. Guru sir, Panchakarma for a healthy person, what are the practical considerations? Is it really recommended, or is it only good to have? Your views, please.
Panchakarma definitely has decisive role on many occasions. Acharya is also very clear in their presentation. Panchakarma, as Dr. Abram has very elaborately explained the whole gambit of entire Panchakarma therapy and modalities and pros and cons and all those things. Very clearly, we can classify into two types of things: Panchakarma for a diseased person and Panchakarma for a healthy person. Typically, the Panchakarma for a healthy person is good very clearly if he fits the Yogyata. That is called, for every Panchakarma therapy, there is an Yogyata and Ayogyata explained by Acharya. If a person is fitting that in that category, then definitely he can be. But there is a season for that. Varsha Rutu will go for Basti, and Vamana is in Vasanta, and now the Sharad Rutu is going on. Now it's a season for Virechana. So like that, there are things are there. And Acharyas have very clearly suggested that every healthy individual at least has to undergo these procedures in a peculiar time of a year when there is a naturally there will be increase of those particular doshas and there will be prakopa avastha of those particular doshas in particular seasons. Accordingly, based on the suitability, one has to undergo this. What is the benefit of doing this? Like if you are going for a healthy cleansing or detoxification or Panchakarma therapies in a different time of a season, definitely it is going to help to improve the functioning of the body. So it will improve the Agni. So you just imagine, the entire body is a complex of many mechanisms. Many instruments are there, something like that in the organs. Everywhere there, the other functions are going on. And whenever there is a function is going on, energy is consumed, energy is liberated, and when things are required, those things are also being produced there. And at the same time, the body also produces mala, the toxins, the byproducts or the waste products that needs to be eliminated. Many times, what so happens is if a machinery is continuously functioning, there is all possibility as accumulation of these toxins. That's what acharyas are telling about. These are the accumulation of these toxins due to various reasons, based on the age, based on the season, based on the time of the day, year, and even the type of food what we are doing. Based on all these factors, then there will be change in the quantity and quality of the doshas inside the body. So if you go for a seasonal cleansing for a healthy person, definitely it will improve the pathways, it will improve the functioning of the body, it will make a more clarity, even Indriya Kshamata will improve, as well as it also helps in longevity. And probably this is the one area which is need to be explored properly for any person in their family. If there is a familial cancers or anything like that, that person's family people for the next generation, in order to avoid the possible cancers, probably every year the seasonal cleansing, when they are in a healthy state, that needs to be performed. If they are regularly doing it, probably they may just postpone these things or they may totally avoid getting the disease. That is an important area where which needs to be studied or even explored. And research has to be, in order to be go for the new area of research that can be taken care of. Second thing, for a diseased person, definitely any diseased person who comes and we cannot straight away go for a Panchakarma. That is not requirement. So whenever a patient comes to us, we need to check it out whether there is a Bahudoshiya Avastha. If it is a Bahudosha Avastha, then accordingly, if it is suitable, then we can go for Panchakarma. If it is not Bahudosha Avastha, our patient is not willing to go for the Shodhana therapy because of his own or her own constraints, maybe financial constraints, maybe time constraints, maybe other things, then maybe he is not exposed to these Panchakarmas earlier, he will not be knowing it, how it will be and what will be the effect, I don't know. So maybe many reasons they may avoid it, and they are being exposed to such a way that their patient will usually come to a doctor, and doctor will see and prescribe some medicines, and that is a total protocol of a practice of an doctor-patient relationship. So when they adopt in these things, definitely they try to avoid the Panchakarma. Otherwise, in a disease condition, definitely we need to go for a selection of the patient which suits the Panchakarma procedure, as well as it also the ability of the person to take this Panchakarma. But if Panchakarma is required and the patient is not willing, then what is the other option? Definitely we go for Shamana Chikitsa. That's what you reaching their goal or result will be delayed. That's the only thing what happens is, if it is done Panchakarma and we go for the regular Shamana Chikitsa, we may reach the target by 1 month or 2 months. Then without doing it, we may reach it by 4 months or 5 months. That may be the reason, because even in Shamana Chikitsa also we'll be doing Agni-Vardhana Chikitsa, we'll also trying to remove the toxins in a smaller doses or suppressing the doshas. So all these things will be doing it. So basically, Panchakarma is one of the important area. It cleanses the body or the Shrotosar, the minute channels, thereby makes the body to function much more efficiently after the procedures. And that's why Acharya has very clearly said, healthy people also should undergo Panchakarma in a disease that's called seasonal cleansing, and disease persons should go for the, according to the diseases, the involvement of doshas. So accordingly, you can go for the Panchakarma therapy. And definitely, I recommend to go for these things, but provided, but don't force that everybody should go for the Panchakarma, and even the patient also should not make the compel the doctor to suggest Panchakarma. Panchakarma is always a selective option. And of course, it should no, just like when if you're going for an operation, that everything will be checked by anesthetist and even the surgeon, everything. Then when physician recommends that it is fit for the surgery, then only it will be taken for surgery. Similarly, all these criteria should be fulfilled. Then only we can go for the Panchakarma.
Thank you, sir. And you had, I mean, you share a lot of skin disease and liver conditions which get treated, and often students are astonished that no Panchakarma was done and only the oral medicines and external application were given in most of the cases. Do you have a measuring scale or a criteria where you would go for Panchakarma, or and where would you not in case of diseases? Like, how do you decide this person is, let's go for Panchakarma, and for some other cases only the oral medicines and external applications?
So as soon as the patient comes up to the examination, I will say that based on the lakshanas, how long these lakshanas are present, and what is his condition is being treated by any other doctors earlier, whether he is taking any medication or that, whether to that those medicines, whether these symptoms are getting reduced or not. All these queries I will do it in regular protocol of history taking. By the time I will be finalizing that whether the patient is suitable for Panchakarma or not. So that is the thing. When a patient says that I have been treated by so many doctors, I have taken so many medicines. Of course, during that period, even he might have skipped so many things or the instructions given by the doctor many times. Even the doctor might have taken some milder format of Panchakarma, which may not be suited to him, or maybe a stronger one, which resulted in complications. All these factors are incorporated into that. So with these things, if a patient comes to me with all criteria, even all these things, I'll go for understanding his condition. Secondly, whenever I suggest that you should go for a Panchakarma, and I will after Panchakarma, I will go for a regular therapy of Shamana. Many times the patient feel that I am in a very distressed condition. I need some result, something which is very easily and as an urgent pace. So if I take these procedures and after that, if I get after 15 days or 20 days or 30 days or 1 month, is it necessary and I need to spend much money on these things? And many times patient may not be willing to get admitted in the hospital and take the Panchakarma. And many times they may have a constraint of the finance. So many things are there. After all this consideration, I will explain to them See, this, for your condition, Shodhana is required. I would suggest you to go for this Shodhana. But as you are not having a sufficient financial backup or you are not having sufficient time to go for that, so let me go for a Shamana Chikitsa. Then I'll go for the Shamana Chikitsa. Like that, usually for each and every patient, I do that. Many times it so happens that patients are, because many times one patient or the other patient who comes with the acquaintance with the my earlier treated cases, or some patients, some doctors, so they'll have an idea that Dr. Guraj sir will do the thing without any Shodhana and like that. So if I tell also sometimes, many times, to go for the Shodhana, they will compel me to that, sir, without Shodhana you do something miracles. Then I will take the help of the nanomedicines or the Prasoshadas, and of course a good combination of those things and a strict Patya that results in the outcome as a very good outcome.
So the original question was, I think it has been answered through this discourse, was that do you use Basti while doing Panchakarma cleanse? Panchakarma cleanse need not, so this was the question, and the short answer is Panchakarma need not be like all the 5 therapies in one patient. It is selected based on the condition, dosha aggravation of the patient, etc. And Raghuram sir, please.
Yeah, sorry to interrupt you, sir. Again, I think this information might add up to our discussion. Not all Panchakarma therapies are given with an idea of cleansing the system or throwing away the morbid doshas. Like we have Brahmananasya or Matravasti or Anuvasanavasti, which are given, so which are not given with the motive of causing cleansing or Shodhana. So they are more over supportive. They are more over to enrich certain things in the body. So like a Brahmanavasti can be given to nourish the nervous system, the musculoskeletal system, to strengthen the system, and a lot more things. A Yapanavasti, when it is given, though they may have mild cleansing action, but the intention is not to give them or administer them with the purpose of causing the cleansing. And we have also seen that Ayurveda has explained so the therapies in such a beautiful way. So like Anuvasana and Astapana are altered. So like an oil enema or the oil or a ghee enema is altered with a decoction enema, so a herbal decoction enema or a milk enema. So alternatively they are given so that they too much hyperactivity of these therapies also don't take place. There is a balance, and each therapy complements and supplements each other. So many things we need to see through the Panchakarma when we are seeing. So Panchakarma should not be understood as only the cleansing therapies, but when individually given, they have different roles to play. Of course, predominantly cleansing activities we have like Shodhananasya, Vamana, Virechana, Astapanavasti have predominantly the cleansing roles, and the others, like as I mentioned already, the Brahmanavasti, the Matravasti, the Yapanavasti, and also the Brahmananasya, all these things. So we need to go according to the description and what is the prefix of that particular therapy. That also indicates with what purpose these treatments are being done. There are also dosha haravastis, particularly focused towards vata, pitta, kapha. Again, we are not confined that vasti is the best treatment or the chikitsa. It forms the half of the treatment of all treatments available, as Ayurveda describes. Here, it is not exclusive, and it is the best therapy for vata, no doubt about that. But it is also administered for pitta and kapha conditions. The ingredients of those medicaments what we use in the vasti will vary. So we have vata haravastis, pitta haravastis, kapha haravastis, tridosha balancing vastis, and we have tissue supporting vastis also, like the enemas which enrich the shukra dhatu or which have aphrodisiac action. So all these things are not given with the purpose of cleansing. A mild cleansing acting with the prefix, whatever role, Shukra Shodhana Vasti. So like if it is there, so it is used for cleansing the seminal pathways and also to enhance the performance of the sexual organs. So like that it is done. And the last thing I would like to add is Gururaja's beautiful addition there about the emphasis of the Shamana Aushadas in a practice. If Shamana Aushadas themselves consist of Shamana, Shodhana, Brahmana, Rasayana, all those medicines included and effectively planned, they will have a very good impact, very good result, as the case demonstrations have been done by Gururaja sir. I can compare that effective Shamana therapies to Achara Rasayana. Achara Rasayana has a Rasayana, but except Kshira and Dhruta, there is no, that is milk and ghee, there are no objective or the objects which can be given as Rasayana. So Chavanprash is also Rasayana, Brahma Rasayana is also Rasayana. Achara Rasayana, the activities what we do, the deeds in which we are involved, all those things are also considered as giving respect to the elders is also considered as uh, Achara Rasayana. But these are the activities which have the Rasayana-like impact. They will have Rasayana-like impact. They are exactly doing. So this is moreover a focus towards, as we are discussing about Panchakarma, Achara Rasayana is for moreover for the healthy persons and who are very much determined to lead a healthy and happy life. They can follow and tap the benefits of the Rasayana without taking any Rasayana, just by following the principles, ethics, and a modus operandi of the life which they have created for themselves in a very, very ethical, the dharmic way, if they can go. So these Rasayanas, Achara Rasayanas, whatever has been mentioned, the template is giving Rasayana-like effect. It is not mandatory that you take Shodhana and take Rasayana. The healthy person can go through the Achara Rasayana way of life and prevent many disorders and still be healthy and happy. Over to you, Heba, sir.
Thank you, sir. Yeah, precautions with the Panchakarma is very necessary. Somebody has written the same in the comment section there. Moving on to the next question. Gururaja sir, please. Is Yastimadhu ghee and mishri a good combination for stomach ulcer? I would like to extend that can this be useful in case of, say, acute gastritis, where the patient, say, after usually common with alcoholic patients, they suddenly have severe gastritis with burning sensations. Sometimes it becomes so severe that they cannot breathe properly. I would like to extend this question to that aspect also. And what would you do in case of acute severe gastritis? Gururaja sir, please.
Definitely, it's a good combination. Yastimadhu, ghee, and misri, and rock sugar. Okay, but definitely I'll go for that Yastimadhu, because Yastimadhu is very clearly established drug to overcome the Amashya Gata Vrana, that is gastric ulcers. So very clearly it has been established. Moreover, it's a Madhur Rasa Dravya with Madhura Vipaka. It acts as a coolant as well as it also helps in, and it is one of the important drug in Sandhana Dravya. So it helps in the tissue binding. So being a Yastimadhu of such nature, even described by Acharya Charaka, definitely it is a very good choice for gastric ulcers. But there is one condition nowadays when people usually approach us, even the Mudavarta or Urdhvagata Amla Pitta as well as Adhogata Amla Pitta, they club together and they'll just simply sell one word, that is gastric. They have got gastric. So what actually the gastric means, and doesn't they bifurcate or anything? We need to ask them, we need to put a lot of questions to understand them. Many a times in these patients of acute gastritis, what I have observed is their apana vayu has not going in apanagati. That is one of the important issue. Apanagati, instead of that, it is become udavarta. It is increased or moving in a wrong direction. So then it disturbs the samanavata. Thereby even it disturbs the pranavata and udanavata. So that's why acute gastritic person will have a very strange complaints many times. Chest pain, sweating, and pain in the neck, even the headache, and even burning sensation in the upper part of the throat. So many things that we need to first here, because if Udavarta is taken place and the Vata has been addressed to go down in a natural way, Apanugata, when it is made to move in Apanugata, then automatically it helps. That's why in these conditions, I go with the Sukumaragata with Hingvastika Churna. In the first morsel of the food, Sukumaragata and Hingvastika Churna, when there are Shatavari Vs Yastimadhu Churna. If that type of combinations are given, definitely it is soothing downward, and being it's a coolant, it also suppresses the pitta. So in these plant, Agni has to be increased, that will be taken care by Hingvastika Churna. So all these combination definitely will help us to treat these conditions of acute gastritis and these type of conditions. If it is clearly Urdhvagata and patient is also having a sore erectation, very clear indication that patient is having sore erectation means, then you can go for the Sadyo Vamana. So Sadyo Vamana will definitely relieve all those things, and the content of the stomach can be expelled out, and patient will have a much relief. Then afterwards, you can go for the Yastimadhu and such type of coolant drugs in that. So definitely it is one of the best choice. Even Saryuga also can be used in these conditions. Shatavari can be used in this condition. So all these are very good combinations. We can go for it.
Sir, is there any condition where like Shatavari is preferred versus Yastimadhu, or they are interchangeable?
Usually, when any supporting documents like the patient may come with OGD report saying that there is a ulceration or pyloric and there is a H. pylori or something like that. So in those conditions, the choice will be estimable. But when a patient comes with a lot of burning sensation as a primary complaint, then Shatavari is also a very good option. It nullifies those burning sensations. And typically when there is a Vidagdhata, I prefer to go with Tikta Rasa Dravyas like Patola or even the Sariva also to much extent that will reduce the Vidagdhata or burning sensation or the Pitta.
Thank you, sir. So, just last question in this topic. So somebody has asked like Avipattikara Churna. I also had the same question. In which condition related to digestive tract disorder would you go for Avipattikara Churna?
A person one who is having a pitta prakriti and having a habituated of alcoholic or smoking or even consumption of daily the masala rich spicy foods and such type of things, and one who is in a pitta kala, means somewhere up to 50 years of age or below that. So in those people I can go with Avipattikara Churna in a small quantity on a daily basis to have a very cleansing bowel evacuation in the morning, maybe once or twice. If once or twice the bowel evacuation happens with Avipattikara, then that will be definitely helping to clear the conditions.
Thank you, sir. So, there is a question on like, can we mix Shatavari and Yastimadhu together to treat say, stomach ulcer and burning sensation? They are not contraindicated together, right, sir?
Definitely, they are not viruddha in any way. They can be added.
Sir, how Sadyo Vamana is done? Can you please explain in brief?
It's very simple. Just by making the person to drink 1 or 2 glasses of milk and just to put a hand in the mouth, just to stimulate the throat, that's still enough to cause the Sadyo Vamana. And of course, it also avoids because we are giving milk, it will also avoid because when we are doing Sadyo Vamana, there is all possibility that the content of the stomach will be throwing out to the esophagus, and which contains a rich content of acid. So that acid may burn the tissues of esophagus. In order to give a protection or something layer like that, we will try to give the person 1 or 2 glasses of milk, and that milk will provide the buffer to these tissues so that they don't get burned by the acids.
Yeah, thank you, sir. Raghuram sir, can you please throw some light on Sadyo Vamana indications, etc., please?
Yeah, sir. So I'm not a great admirer of Sadyo Vamana, but many people practice this Sadyo Vamana. Again, as I said, even in healthy persons, Sadyo Vamana can be given in Dosha Avastha, so when the doshas are exacerbated and ready to be thrown, or as a part of like as I mentioned, the seasonal therapies where, example, Vamana can be given in Vasanta Rutu. In such conditions, Sadyo Vamana can be given, or in many people consider. So there is a programming of these Panchakarma therapies. Like some conditions need Ubayataha Shodhana, so that Vamana and Virechana both are needed. Some doctors have simplified things, like they conduct a Sadyo Vamana and immediately go to Virechana, where Vamana and Virechana both are needed. On a Sunday, Vamana is given, and from next day again, Snehapana is started, and the complete therapy of Virechana is given. Or one weekend, Sadyo Vamana is given, another weekend, Sadyo Virechana is given. Sadyo means immediate, which has immediate action. So we cannot promise that the entire morbidity or the dosha morbidity can be thrown out or expelled out from the system with this Sadyo Vamana procedures. But these are for convenience. So we can have it for convenience. If Vamana can be given, but the protocol or the number of days are not suitable. But if the physician thinks that one day I'll give Vamana and Next, I'll follow with Virechana, or only Sadyo Vamana is enough in this condition. I will try to expel the excessive, like what we can call it as Utklishta, excited doshas. Like example, Vamana, there is a Kapha Utklesha, I'll throw, like in a chronic gastric condition or a gastritis, I'll throw that Vamana by administering Vamana. From the next day, I will start with the Shamana therapies. Why? Because the person doesn't have time, or there is a limited time, and still Vamana is needed in that condition. Number two, because the physician thinks that the doshas are exacerbated in a mild to moderate quantity, and this condition might not need the Krama Vamana. So like Krama Vamana is Snehana, Svedana and Vamana, all those procedures are not needed. Just whatever kapha is excited, I'll just throw that and start with the Shamanoushadas or the palliative treatment. So even in such conditions, the Sadyo Vamana and the Sadyo Virechana will be followed. So this is as a part of the general practice, and according to convenience, moreover a convenient treatment where they are needed. The Roga Bala is good, the Rogi Bala. So the strength of the patient, the tolerance of the patient is good. The doshas are exacerbated in a mild to moderate quantity, and Vamana or Virechana is needed, but not as a complete procedure. So seeing that the Vyadhi Bala, the strength of the disease is less, the Dosha Bala, the strength of the doshas are less, and conveniently this treatment can be placed before starting the palliative treatment, because Shodhana before Shamana. So we will be following that classical reference also, and we can go with Shamanaushadha later. So considering these things, a physician can take up like advising a Sadyo Vamana or Sadyo Virechana.
Thank you, sir. There is a question here, like my husband went through Panchakarma and lost a lot of weight. Is this normal? What can one do to gain back the lost weight? And is the weight gain really needed if the person is eating well and sleeping well and staying active?
So here, Vasanta Reddy madam, I want to, what I want to tell here is, there is a substantial weight loss, especially if the therapies are given with the purpose of like Shodhana, like cleansing therapies. Here you mentioned Panchakarma, so it would give us a clarity if that was Vamana or Virechana or what type of therapy was given. So we can have a better idea. So there is some weight loss definitely going on in the Panchakarma therapies. Not all Panchakarma therapies, as I already said, if they're given with the purpose of Shodhana, number one. And if the therapy has been excessively administered, so like the quantity of the medicine or the evacuation of the doshas take place in a large quantity, so then also there is a chance of weight loss. And number three, if the Shodhana is planned for weight loss therapy, as a part of weight loss therapy, if it has been planned, there is weight loss, but like if everything doesn't fall into place and or sync, there may be excessive weight loss through the Panchakarma. So coming to the bottom line, weight loss after Panchakarma is okay if it doesn't hamper the general health of the individual. Like if there are no other complications along with the weight loss, if there is severe weight loss and the person is deteriorating with in terms of health, physical health, so there is a lot of disturbance like joint pains and other things, cramps developed and also sleeplessness, lot more things, then it is not a healthy weight loss. So generally the weight loss which occurs in Panchakarma is a healthy weight loss. The person will gain back the normal weight. So like, or come back to the normal closure of the weight what the person was having. Once the therapy has been completed, and the follow-up, what I am telling is Panchakarma, the follow-up interventions or the dietetic protocol, everything has been followed. The weight is not at all an issue. But after Panchakarma, if there is a severe weight loss and if the weight loss is playing, so like interfering with the general health, then that is not a healthy weight loss. It is not normal. Caution needs to be taken in this particular condition. Consult back the doctor and ask them what exactly needs to be done if there is some imbalances.
And sir, in the, after Panchakarma, yes, the weight loss is quite normal. But, the hunger and bala of the patient become important. If they're feeling fatigued all through the day, etc. If that is happening, then care needs to be taken.
It is mandatory, sir. Samsajana Krama is mandatory after Vamana or Virechana. So because we need to have a graduated dietetic protocol from liquid diet to semi-solid diet to a solid diet and then a normal diet. In that particular chronology, we have to go because there is the Agni has been shocked. Agni is in shock after these therapies. So the basic metabolism is under a shock. We need to help Agni recover gradually. It cannot digest the food, normal food or the whatever we are taking immediately after the therapy, especially Vamana and Virechana. After these two therapies, Samsajana Krama, as Heber sir has rightly mentioned in the slide here, is mandatory. As a golden rule, it has to be followed. Liquid diet, semi-solid diet, normal diet. Okay, so that takes time. Depending on how much cleansing has happened, it takes time. Samsajana Krama definitely helps in the recovery of the strength and also the other small hiccups what are there in the treatment, the strength, the digestive strength, the general health, everything will pick up. So that is why as the therapies, the pre-therapies and also the post-procedures, these are the post-procedures are very, very important. If these things are not done, so definitely we cannot assure good results. And having said this, Samsajana Krama is not applicable to the Basti Chikitsa and also the Nasya Chikitsa. It's not applicable. It's not that diet should not be followed there. There also we have dietetic indications that can be followed, but they're not termed as Samsajana Krama, and that particular chronology of the diet is not followed after Basti and after Nasya.
Yes, sir. Thank you there, sir. And there are a few questions, like somebody has asked about complications in during Panchakarma. If you go to Easy Ayurveda, search in Google Easy Ayurveda Charaka Siddhisthana complications of Panchakarma, you will get that. And Guraja said in case of Sadyo Vamana also on the previous day Dosha Utkleshana is to be done with say black gram and curd, etc. In case of if you are planning for Sadyo Vamana, the day before should we be doing dosha, kapha dosha utkleshana with black gram, curd, etc.?
You see, the question doesn't arise. Patient has approached my clinic, and after examination, immediately patient was taken for Sadyo Vamana, and by giving 1 or 2 glasses of milk, the things were done. If it is to be planned accordingly, then we'll go for the Kramavat Chikitsa of Vamana. Here, the dosha utlishtata is in such a form that by slighted stimulation, the things of the content of the gut will be cleansed or cleared of instant relief. That's only for the purpose of doing Sadyo Vamana. Sadyo Vamana is give you only instant relief from maybe itching, maybe burning sensation, or maybe pain or something like that for a momentary period. So it doesn't mean that if you do Sadyo Vamana, things will be getting everything right. No. It will give you a momentary relief, which is very much required from the point of patient. So we will be doing it. So there's no question of because whenever a patient comes, we examine them, and if it is required, then and there only, after convincing the patient, we'll go for the Sadyo Vamana with a simple procedure of giving 2 glasses of milk and just stimulating the throat. The things will be cleared.
Thank you there, sir. And last question before we wrap up. Raghuram sir, for the Vamana in spring for a healthy person, what else can be used? One suggestion was milk. Milk is not like go to drink for Vamana as such. It's just it got just mentioned in the case of say Sadyo Vamana discussion. Raghuram sir, quick answer please before we wrap.
Yeah, we can use kshira if milk is tolerable, and medicated kshira like Yastimadhu processed kshira, or we can go with the yusha also. So the yusha is soup-like preparations which can be prepared with kaphahara dravyas like Yastimadhu, etc. And it can be given akanta, and it can be used as the emesis therapy.
So that sums up today's discussion. Thank you all the students for active participation, and on behalf of all of our students, my words of gratitude to Guraj sir and Raghuram sir. Thank you.